Here's the scary truth. Many life-threatening diseases don't appear suddenly. They often develop silently, sending subtle warning signals weeks, months, or even years before becoming a medical emergency. The problem is that most people don't recognize these early clues, or they assume they'll disappear on their own. By the time they finally seek medical help, valuable time may already have been lost. In today's video, we're revealing 7 warning signs that people commonly ignore until it's too late. Some of these symptoms are linked to conditions like heart disease, diabetes, thyroid disorders, certain cancers, and other illnesses that respond much better when detected early. And make sure you stay until the end, because the final warning sign is one that millions of people experience every year, yet many never realize it could signal an emergency. Today, you'll learn how to recognize these warning signs and understand when they shouldn't be ignored. Let's begin with one of the most common symptoms people dismiss every single day. Feeling tired every day? You might think you just need another cup of coffee. But what if your body isn't asking for caffeine? What if it's asking for help? We all feel tired from time to time. After a late night, a stressful week, or a demanding workout, fatigue is completely normal. Persistent fatigue can sometimes be associated with conditions such as anemia, where your body doesn't have enough healthy red blood cells to carry oxygen efficiently. Without enough oxygen, your muscles and organs have to work harder, leaving you feeling drained. It may also occur with thyroid disorders. The thyroid gland controls your body's metabolism, and when it isn't producing the right amount of hormones, everything slows down, including your energy levels. Heart disease can be another possible cause. When the heart isn't pumping blood efficiently, less oxygen reaches the body's tissues, making even simple activities feel exhausting. Sleep disorders, such as sleep apnea, can also leave people feeling extremely tired despite spending 8 or even 9 hours in bed. While caffeine can temporarily increase alertness, it doesn't treat the underlying cause if a medical condition is responsible. If you've been feeling unusually tired for weeks without a clear reason, it's important to speak with a healthcare professional for proper evaluation. Remember, your body spends enormous amounts of energy trying to keep you healthy. When something isn't working properly, fatigue is often one of the earliest clues. Before we reveal the next warning sign, here's something surprising. Many people celebrate it. Friends compliment them. Family members ask for their secret. But behind the scenes, their body could be struggling with a serious health problem. Now, let's talk about a symptom that's often misunderstood. What if the number on your scale keeps going down, but you haven't changed your diet, you haven't exercised more, and you weren't even trying to lose weight? It might sound like good news, but sometimes unexpected weight loss is your body's way of asking for help. Many people spend months trying to lose a few pounds, so when the weight suddenly starts coming off without effort, it can feel like a pleasant surprise. But unexplained weight loss should never be ignored, especially if you've lost a noticeable amount over a relatively short period without changing your eating habits or activity level. There are many possible reasons why this can happen. One common cause is an overactive thyroid, also known as hyperthyroidism. The thyroid gland controls how quickly your body burns energy. When it becomes overactive, your metabolism speeds up, causing your body to burn calories much faster than normal. Another possible cause is diabetes. When blood sugar remains too high and insulin isn't working effectively, the body's cells can't use glucose properly for energy. To compensate, the body begins breaking down stored fat and muscle, which can lead to noticeable weight loss. Chronic infections may also increase the body's energy demands as the immune system works overtime to fight illness. It's important to remember that weight loss alone does not mean someone has cancer, but it is one reason healthcare professionals may recommend further evaluation. Pay attention if unexplained weight loss is accompanied by other symptoms such as persistent fatigue, loss of appetite, night sweats, ongoing digestive problems, fever, persistent pain. The combination of symptoms often provides more clues than any single symptom alone. Our next warning sign often starts so subtly that people barely notice it. It might happen while typing on a keyboard, holding a cup of coffee, or even while walking. Many people assume it's simply poor circulation, but sometimes it's your nervous system sending an important message. Have you ever experienced that familiar pins and needles feeling after sitting in one position for too long? That's completely normal. When pressure is placed on a nerve, sensation temporarily changes, and once the pressure is relieved, everything returns to normal. Persistent or unexplained numbness should never be ignored because it may signal that the nerves, brain, or blood vessels aren't functioning as they should. Have you ever felt your hands suddenly go numb or noticed a tingling sensation in your feet that keeps coming back? Many people shrug it off as poor circulation or assume they simply slept in an awkward position. But when numbness or tingling becomes frequent, persistent, or appears without an obvious cause, it could be your nervous system trying to tell you that something isn't right. Your nervous system is like your body's communication network. Every movement you make, every sensation you feel, and every signal sent between your brain and the rest of your body travels through an intricate web of nerves. When those nerves become damaged or compressed, unusual sensations such as tingling, burning, numbness, or weakness can occur. One of the most common causes is diabetic neuropathy. Another possible cause is a vitamin B12 deficiency. Vitamin B12 plays an essential role in maintaining healthy nerves. Without enough of it, nerve function may become impaired, leading to numbness, balance problems, memory issues, and weakness. Nerve compression is another common explanation. Conditions like carpal tunnel syndrome occur when a nerve in the wrist is compressed, often causing tingling or numbness in the fingers. Similar compression can happen in the neck or lower back, affecting the arms or legs. However, there are situations where numbness becomes a medical emergency. If numbness suddenly affects one side of the body, especially if it's accompanied by facial drooping, difficulty speaking, sudden confusion, or vision problems, it may be a sign of a stroke. A stroke occurs when blood flow to part of the brain is interrupted. Every minute counts because brain cells begin to die when deprived of oxygen. Healthcare professionals often encourage people to remember the FAST warning signs. F. Face. Does one side of the face droop? A. Arms. Can both arms be raised equally? S. Speech. Is speech slurred or difficult to understand? T. Time. If any of these signs are present, seek emergency medical care immediately. The earlier treatment begins, the better the chances of reducing permanent disability. Most cases of tingling aren't caused by a stroke, but frequent or unexplained symptoms should still be evaluated by a healthcare professional to identify the underlying cause. Everyone develops a cough from time to time, especially during cold and flu season. In most cases, it clears up within a couple of weeks. However, a cough that lasts 3 weeks or longer, especially if it keeps getting worse or is accompanied by symptoms like coughing up blood, unexplained weight loss, chest pain, or shortness of breath, should be assessed by a healthcare professional. A persistent cough can have many causes, including asthma, acid reflux, allergies, chronic bronchitis, lung infections, certain lung diseases, Do you constantly feel thirsty, even after drinking plenty of water? If you are making repeated trips to the bathroom throughout the day, or waking up several times each night to urinate, your body may be trying to tell you something. Occasional thirst is completely normal, especially after exercise or spending time in hot weather. But excessive thirst that persists for days or weeks isn't something to ignore. One common cause is diabetes. When blood sugar levels become too high, the kidneys work harder to remove the excess glucose through urine. Early diagnosis of diabetes and other conditions can help prevent long-term complications affecting the eyes, kidneys, nerves, and heart. We've reached the final stretch, and the next two warning signs are among the most overlooked of all. Before we reveal the final two warning signs, take a moment to think about something. How many times have you ignored a symptom because you assumed it would go away on its own? Most of us have done it. Now, let's reveal one of the easiest warning signs to spot, but one that's often overlooked. Your skin is the largest organ in your body, and sometimes it's the first place where signs of an underlying health condition appear. The question is, would you recognize them? Most people think of their skin as simply a protective covering, but it can provide important clues about what's happening inside the body. While many skin changes are harmless, some deserve prompt medical attention. For example, yellowing of the skin or eyes, known as jaundice, can occur when the liver or gallbladder isn't functioning properly. It may be associated with liver disease, bile duct problems, or other medical conditions that require evaluation. This final warning sign sends millions of people to emergency rooms every year, yet many people still mistake it for heartburn, muscle strain, or simple indigestion. That misunderstanding can have devastating consequences. When people hear the words heart attack, they often imagine sudden, crushing chest pain that causes someone to collapse. But that's not always how it happens. In many cases, the warning signs are much more subtle. Chest discomfort may feel like pressure tightness, fullness, burning squeezing, and uncomfortable heaviness. Some people experience discomfort that spreads to the jaw, neck, shoulders, back one or both arms. Others may have symptoms such as shortness of breath, cold sweats, nausea, lightheadedness, unusual fatigue. While chest discomfort doesn't always mean a heart attack, persistent, severe, or unexplained chest pain, especially when combined with other concerning symptoms, should never be ignored. If you or someone around you experiences symptoms that suggest a heart attack, seek emergency medical care immediately. Prompt treatment can significantly improve outcomes and save lives. Remember, when it comes to the heart, it's always better to be evaluated and reassured than to wait too long. Our bodies are remarkably intelligent. Long before many illnesses become serious, they often send subtle signals that something isn't right. The challenge is learning to recognize those signals and taking them seriously. Let's quickly review today's 7 warning signs. Persistent fatigue, unexplained weight loss, frequent numbness or tingling, a cough that doesn't go away, constant thirst and frequent urination, unusual skin changes, chest discomfort or pressure. It's important to remember that these symptoms can have many different causes, and experiencing one doesn't necessarily mean you have a serious illness. Thanks for watching. Subscribe and follow for more. If you found this video valuable, you'll love our next one. Eat this every morning and watch what happens to your body.